Stop. Take a look at your brush right now. If you're seeing clumps of hair, like all the time, every day, it's not normal. And I don't want you to think it's just stress. It's often your thyroid failing, and your hair can be the first sign you've been ignoring. I'm talking about thinning ponytails, widening parts. Hair feels like straw no matter what you do. And here's the thing, thyroid disease affects 1 out of every 8 women. And by the time you're getting hair loss from it, your body's been having this problem for many, many months. My name is Dr. Alan Christianson. I'm a board-certified naturopathic endocrinologist with 30 years experience treating thyroid disease naturally. In this video, I want you to know the 4 big clues your hair is giving you about your thyroid health and what the first steps are you can take into getting it back on track again. For starters, I want you to understand how your hair works and how this applies to your thyroid. We're often told that our hair is just dead protein, and it's not a good way to think of it. It's a lot more complicated than that. Think about your follicle as being a factory with different settings. It's got like a conveyor belt, and it can be growing, winding down, or resting. The first stage is the growth stage. This is called anagen. This is hair's prime time when it's getting longer and stronger. For most people, this can be anywhere from 2 years to even up to 7 years. At a given point in time, about 60 to 80% of your hairs are in this active growth stage. This is where there's a lot of intense activity, there's new cells coming out, and hair is going to this nice, luscious, healthy length. Now, what happens is that thyroid hormones are a big part of this. They're basically acting like the master conductors, making sure that you've got these right cycles occurring between these different stages. After the stage of growth, we've got this wind down stage called the catagen stage. This is usually a couple weeks, and this is where the follicle starts to shrink and it detaches itself from a blood supply and it gets prepared for a rest. So it's kind of like a short but necessary intermission. Then finally, we have the telogen phase. That's where the follicle actually rests and the hair sheds, and there's nothing really coming from this follicle. So this is about 3 months. Right now, about 15 or 20% of your hair follicles are at this stage. But the problem is that thyroid hormones need to be in the exact right balance and the exact right proportion for you to have those ratios. When the thyroid hormones are too high or too low, or there's chronic thyroid inflammation, you can get a lot of hairs stuck in the catagen rest phase or the actual sedentary phase where there's no activity going on at all, or too many of them line up and shed all at once. This is common. And what this means is that when thyroid levels aren't right, nothing happens instantly, but because of how slow these follicles are growing, it means that the coming 3 to 6 months, you may have these misalignment events occur with the timing. So it's always a delayed effect. Now I want to talk through the big specific clues you can look for to know if your thyroid might likely be a culprit. The first big clue is diffuse and even thinning. This is often one of the most frustrating changes tied to thyroid disease. If you run your fingers through your hair, especially the crown or the temples or the nape, and you're getting more than about 15 or 20 hairs each time, that means you're getting some more thinning. This is time to pay attention. For most healthy adults, fewer than 10 strands is considered normal. If you do some thorough checking and you're getting much more than that, this can be a significant clue. What's tricky about thyroid-related hair loss is it's often uniform. It's often even throughout the whole scalp. It's not so much just one spot anywhere, but there's different types of thyroid disease that show up differently. So with hypothyroidism, for example, you might first notice that the part looks wider. Wherever you part, it looks wider than it would otherwise. Or you might see that the ponytail is just less substantial than it was before. You need less wraps around the band or more wraps around the band to hold that in place. And these things mean the overall density can be less everywhere else. And that's with too little thyroid hormone, but with too much, we can also see a really excess rate of shedding. So it's not as much gradual and sneaking up, it's more so very high numbers of shedding that you would notice when you're running your fingers through there. And that's the paradox here, is that whether the thyroid is overactive or underactive, both can cause this excess shedding. The medical term is telogen effluvium. It just means there's too much shedding going on, that your thyroid timing is off. The follicles are putting too much out constantly. The next big clue is the texture not being right. So healthy hair, it's got a smooth outer layer to it, kind of like roof shingles lying flat. That's what makes it shiny. But when thyroid hormones aren't right, these little tiles on the edge don't line up properly. And the hair looks more rough, more dull, and even if you're dyeing your hair, it won't stick on it properly. So the coloring won't even take right. And that smooth, intact surface, when that's there, that reflects light properly. That's what makes the hair healthy, gives it a good sheen, gives it a nice, soft, silky feel. But when thyroid hormones are low, many of these events don't work right. You can get too much sebum from your scalp's oil glands, or it's not produced in amounts that are significant at all. When there's too little of that, the hair gets dry and brittle and can break very easily. The other connection is that the keratin, the main protein that makes up the hair, we don't produce that quite as well. There's just too little of the protective shingles, so to speak, and that makes it to where the hair becomes uneven. There may be enough of it on part of the shaft, but not enough on the other. And that makes the hair feel different. It can feel more coarse or more cottony or even more wiry than typical. And this can happen even if you haven't changed your hair products or your routine. And that's because the overall growth of the shaft itself is skewed by thyroid hormones. The third clue can be changes in specific hair locations. There's a sign that doctors are taught about called the Hertog sign, and that's where the outer third of the eyebrow starts to thin. The person only has a tiny bit of eyebrow on the inside. This can be a more specific sign of thyroid-related hair loss. Other things can cause that too, but thyroid disease is among the more common one. And then specific parts of body hair can change as well. Maybe you're not needing to shave your underarms as much as before, or pubic hair becomes more thin or sparse. These can also be signs of thyroid disease. And the reason for this is that the body needs a certain amount of T3, one of the more active thyroid hormones, to keep hair in that active anagen stage. And it's true for all hair in the body, but some regions of the body are more affected by that early along than others, especially the outer portion of the eyebrows. And the last clue is that the strands get more brittle and they can break more easily. So not even just about dryness of the hair, but the structural integrity. If you pull out a couple of hair and look closely, you can see the root end. A healthy hair will have a little small club-shaped white bulb at the end. And that's where the hair is going to come from the follicle. When there's that bulb there, that means it completed its growth cycle normally and it attached cleanly. But if there's a little black tip or no bulb at all, that means the shaft fractured prematurely, breaking off before it had a chance to finish its natural cycle, and it didn't get to disconnect from the follicle in a healthy way. When this occurs, it can also happen that the hair splits longitudinally along its length. And that's where we get this brittle thyroid textbook pattern. So it's not just split ends, it's a weakness throughout the whole length of the shaft. And at a cellular level, these inadequate thyroid hormones, they're impairing the production of proteins. And the hair doesn't have the right strength to maintain its length. It breaks and shatters lengthwise. That's why we can see the tie-in of many other factors with thyroid hormones, because together they all affect how stable these things are. So those are the main clues to look for. I'm going to briefly mention some common patterns of hair loss to think about too. The big ones here I mentioned was chronic telogen effluvium. That's this excessive shedding. That's the most common with thyroid disease. Next most common is called androgenic alopecia. That's where the hair is thinning more along the temples or the crown. And in this case, this can be too much androgenic hormone, but thyroid hormones can also make this more likely to occur. The last big pattern is called alopecia areata. That's where there's some patches that are totally bald or there's hair loss just everywhere. In that case, it's not so much because of the quantity of thyroid hormones, it's more so because of the overall thyroid autoimmune response that's driving another autoimmune response. So if you suspect this, what do you do about this? First thing you got to do is check your thyroid, get a real thorough thyroid test. If you go to your doctor and ask for thyroid tests, you're probably just going to get a TSH run. And it's better than nothing, but the problem is that the most common single thyroid issue that causes hair loss is thyroid autoimmunity. Adult women, somewhere around 27% of them, have significant thyroid autoimmunity, but only about 1 in 100 has had their thyroid totally shut down in ways that make it obvious with their TSH scores. 27% can have autoimmunity, 1% can have full-on, complete, overt hypothyroidism. And what that means is that of those who have had thyroid-related hair loss, 26 times they're more likely to have nothing show up if they don't check for the autoimmunity. So you've got to check the TSH, but it's good to also check thyroid antibodies. The main two here are antithyroid peroxidase and antithyroglobulin. Now, thyroid hormones also matter, the T4, the T3. The free T4 is a little better than total T4. Total T3 is a little better than free T3. But honestly, if you're just checking them, that's the best step. The most important single takeaway here is to get your thyroid antibodies tested. And if your TSH is above range, even if your gland hasn't shut down, that still can be relevant. There are some people who have autoimmune thyroid disease who don't have elevated antibodies. And those cases are the least obvious, but we know about that when we know structural signs of change. So if there's really strong suspicion of the thyroid causing hair loss and the antibodies are normal, the TSH is normal, but there's signs of difficulty swallowing or hoarseness or changes to the voice, those are all good signs to get a thyroid ultrasound. And sometimes that's the only way the autoimmunity shows up. And when you know it's there, it can be a big driver causing the hair loss. If this is helpful, subscribe to this channel and share this with someone else who might find it helpful. And if you want to learn more about natural treatments for thyroid-related hair loss, I'll give you a link in the description to a related follow-up video. In the comments, share some of the big takeaways you've had, share any things that you saw from here. And the high-level thing I want you to be aware of is that thyroid disease, it's a big deal. It's common. It affects a lot of people, but it's often missed. It's often underdiagnosed. But with thorough evaluation, with good diagnosis, there's almost always safe, natural treatment options. So don't give up hope and don't feel like you can't get better. There are good solutions out there. All right, Dr. C with you. Take good care.